We are live. Hey, you guys. We are live. We are here for another live stream, and I am so excited. We have such a special guest for this stream today. Let me see who's already in here, who's in our live chat. Hey, Jennifer Nightingale. Oh, I'm so excited that you're here and you're excited. If you guys can hear me, please let me know in the chat right now. Let me know I can hear you. I can see you. Everything's looking good. Here we go. Good morning from Edmonton, Alberta. Here we are. Cleo. Hey, Holly. Thank you for joining, you guys. Let me know, as always, where you're watching from and what you're drinking. That's what we do every single live stream. I don't have a drink with me today. Guys, I don't have a drink with me today. It's like I'm a newbie. Here's another Gabi. Hey, Gabi from Argentina. Oh, that's awesome. You guys are all hopping in. Come on in, get comfy. Get your drink, get a snack, pop it in the chat, what you're drinking. That's our thing, you know, that's our glam thing. Hi from Portugal. Oh my gosh, this is awesome. Mara from Portugal. Hey, you guys, this is going to be a really good stream. Springfield. Okay, we have everyone from all around the world. Alabama. We have, oh my goodness, this is awesome. Hey, Lisa, welcome. Welcome to the chat. I'm looking down, you guys, because the chat is down here for me. We have someone from London, someone from Paris, France. Oh my gosh, I love it when you guys come from all over the world. It warms my heart so much. So it is not about me today. So I really want to get right into it. Today, you guys, I have a very, very, very special guest and someone that I'm very proud to call my friend, because this man is amazing at what he does. He's unbelievably not only successful, but incredibly intelligent, has so much knowledge. We're pretty lucky, actually, that we got him on this stream today. So without further ado, I want to make sure we get as much time as we possibly can for this stream so that you can ask questions and get them answered, because it's not every day that we can bring in one of Canada, and I would say even the world's best plastic surgeons. So this is Dr. Cory Goldberg. Welcome to the Glam Fam, Dr. Cory Goldberg.
Thank you so much, Gabriella. It's so kind of you. That is a wonderful introduction. I'm honored, and thank you so much for welcoming me on your stream.
Oh my gosh, when I asked you, all of us here on the team were like, oh, I hope he says yes. This will be so good, because there's so many questions, and they're not questions that I can even begin to answer. So it's going to be really valuable for everyone.
Well, you know, Gabriella, I really appreciate your approach to beauty, and I think that your following does as well, because you're a very real person. You present things as they really are, and I think you help people really understand what beauty is. I really admire you a lot, and I'm happy to share, spreading the message of real beauty. So I'm super excited about the show and to talk with you.
Oh, thank you. That means so much to me. So I'll give you guys a little bit of a backstory. So the reason that Dr. Goldberg and I know each other is because about 7 years ago, I actually had a rhinoplasty done. And some of you guys may know that, and some of you guys may not know that. And I'm very transparent on this channel about procedures that I have done, things that I have done. I'm really not ashamed of it. I really don't feel any need to hide it, because, sharing kind of empowers us to learn about different things that we may or may not want to do. Some of us don't want Botox at all. Some of us don't want fillers. Some of us want all of the things, right? So this is me with my baby. This is my first son, who is now almost 10. And this is what my nose used to look like. This is what I used to look like before I met Dr. Goldberg. And I always hated my nose for as long as I can remember. So I reached out to him, kind of just wanting a little bit of information. I wasn't even sure I was going to go for it. And then we got along so well. He has such incredible bedside manner. I felt so comfortable. So then I did it. And you guys, I'll show you what. Okay, so the bottom picture is the before, how my nose looked straight on, how my nose looked from the side, and then how my nose, the recovery process. So Holly just says, your nose looks so natural and I love it. And I think that's the reason why I really wanted to bring Cory here, because he is such an artist at what he does. And he's so skilled at enhancing and making things look really balanced, but also very natural. And I I love my nose now. It's probably one of my favorite features. And I think it's because it was like painted by you, you know?
Well, I'm honored, and you were beautiful before, Gabriella. You still are, and the nose is a funny thing. It's such a central and important feature on the face, and minor subtle changes just to sort of make it fit and balance with everything else can make a really dramatic change to how someone feels about themselves and how their overall look, but without making them look like a different person. A really good rhinoplasty or nose surgery, people walking down the street shouldn't look at you and say, wow, that's a great rhinoplasty. They should just never really notice. It should just blend. And so, I'm really proud that you're so pleased with your results. You look amazing. And that's one of the powers, and I feel very fortunate to be able to do what I do, is to sort of help people feel that way about themselves.
Totally. And I remember being so scared about that and going in, and I was so crazy showing you a million pictures and saying, listen, I'm Brazilian. And I'm like, I want to look Brazilian. I don't want all of a sudden to have this really Caucasian kind of, I don't know if you remember, I'm like, I don't want like a ski slope nose that's super cute on like a white girl. I just didn't feel like it, and I was like, I just want the hump gone and it more balanced, but I want it to look like I was born with it. And no one has ever asked me if I've had a nose job, because it does look normal. It looks completely natural, which is exactly what I wanted. So it's always about, improving, not perfecting or whatever.
You're absolutely right, and one of the things I know that we agree on very much is the current perception of beauty is one which is very exaggerated, and there are people who come to me and ask for their rhinoplasties to look overdone, to have a ski slope and a really upturned nose, and honestly, I don't do that kind of surgery because it's not right. Those sorts of exaggerated appearances, it doesn't make someone more attractive. It just makes it look like they've had something done. It makes them look unnatural, and it takes away from their overall beauty. So, achieving a natural result that truly fits with someone and enhances what they look like, not creating a new or different feature. That's the artistry of the cosmetic industry, and I love doing that, and I'm really proud that I'm proud every time I see you online. I really feel good about that.
Oh, that's awesome. All right. Well, let's get started with our questions. You guys have so many questions and we have to get through as many as we can. So why don't we go and we'll do a community post question first, okay? So Julie asks, I'm 60. What do you recommend for a newbie for changes to sagging jowls? I was born with a receding chin. I'm not wanting to restructure my chin as much as I want to get rid of my jowls.
So that's an excellent question, and I think Julia, it's great that you ask that in the context of recognizing that your chin and your jowls and lower face are related to each other, because it really highlights the idea that different parts of the face, they need to fit together, and there are relations that are really important. And the chin and the lower face are definitely a pair. So a retreating chin or a weak chin, it results in less support to the lower face and to the upper neck. And so if you think, for example, about the top of a tent, if you have the tent pole kind of out straight, the tent will be held tight and appropriately, supported. The chin is kind of like that tent pole. It's the central structure supporting the lower face. For someone who has a weaker chin, there's less support there. So those people who have a retreated chin, they tend to get more jowl formation and loosening of the lower portion of their face as a result of that. So the correction can involve either tightening of the jowls or extending the chin, or potentially even both, depending on the anatomy and sort of how extensive what you see is. So oftentimes I will do a combination procedure where I will bring someone's chin forward at the same time as tightening. But let's kind of look at the different options for both of those things. So, to bring a chin forward, one of the things that you can do is simple injection. I mean, injectable filler is really, an elegant way of enhancing a chin, bringing it forward and giving more balance. It does tighten the skin a little bit, and so some filler to the chin and to the jowls, alongside of some dissolving threads that can bring up the lower face and the sort of jawline up to the jowls. That's a really great non-surgical way of softening up that whole area. And so that's a great way to kind of balance everything out. And for some people that would be enough. And it's, for many people who would prefer to avoid a surgical intervention, that's a great way of going about it. But it's a temporary fix. So you're looking at about a year and a half or so, maybe 2 years that you would get out of something like that. A more permanent fix would involve the chin, which potentially could be either a chin implant, or personally, I favor genioplasty, which is an advancement of the chin bone, and at the same time a facelift, which can then bring up that extra skin along the jowls and the lower face. So that combination of the chin with the facelift is great for those who have a very retruded chin. For some people, if they prefer to avoid surgery on the chin, just the facelift alone would be enough. But again, it really comes down to sort of how much lack of projection is there. If the chin is really is weak and there's nothing there, oftentimes I'll tell a patient that it would be best for them to have some support. So really, Julie, the answer to your question is, it depends on how weak your chin is, whether that needs to be addressed or not. And secondarily, sort of how much loose skin there is. Would a non-surgical option such as thread lifting be enough, or are we looking at doing something more surgical in order to sort of take care of that extra skin that you've got?
That's a great, that I have so many questions after that. So I'm going to pop up one that goes with what you said. So this is another question from the community board, and you mentioned threads a lot in your answer. So this viewer, she's considered getting thread lifts, but she's like an honest opinion about them. She's not rich, so she doesn't have that type of disposable income to spend on it. So I'd like to do a treatment that I will get the best value for the cost. So tell us what you think about thread lifts. There's so much, there's a lot of polarizing thoughts about thread lifts online.
Yeah, I'm first of all, I guess overall, I'm a fan. I do thread lifts. I think they're a great tool. They have benefits, and like any tool, they need to be used appropriately. If the only tool you have is a hammer, everything in the world becomes a nail. So, threads aren't the solution to everything, but when used appropriately, they can achieve really nice results. When they get overused, then then they get past what they're useful for, and there are definitely some risks associated with them. But before I talk about the threads in their current, fashion, I want to talk a little bit about the history of threads, because sometimes people's impression about threads stems from historically what they used to be. So what threads used to be were permanent. And so the threads that were used were varieties of polyethylene, plastic, things that didn't dissolve. And those threads had barbs or little hooks in them, and you would use those to do lifting or tightening. Those kinds of threads are, I would say, historic. They're not safe to use for sort of general soft tissue lifting or movement. The reason that permanent threads aren't so good, and they used to cause issues, is because they could migrate. They could also get contaminated and have fluid or tissue or granulation, like almost a low-grade infection form around them. In a permanent thread, that can't really be treated. And I had some patients come to me, earlier in my practice who had threads done at other centers, even some that were years earlier, and they had lots of problems and issues that I ended up having to remove these threads. That's a long time ago. We don't do those anymore, and the reason is because of those risks. So the new iteration, the way we do threads now, is that they're dissolvable threads, and these threads are made of polymers, things that your body can digest. It's biodegradable, and in fact, it's the same kind of suture or thread material that we use for our dissolving sutures. When we stitch things internally, your nose surgery, for example, I used a particular type of dissolving thread to reshape the cartilage. That's pretty much exactly the same kind of polymer that these threads are made out of. So because they're temporary and they're dissolvable, they're also tolerated. The body doesn't react to them. The body digests them. So there's not really a potential for infection. And also they can be managed. So from that point of view, they're much safer. And that's why I'm a fan of them in the right circumstance. So the people who are good candidates are people who have reasonably thick skin and also have only a moderate amount of sort of tissue lowering or loosening. If someone's skin is too thin, or if it's too thick, they're not great candidates. If it's too thin, then sometimes you might be able to see the threads through the skin, or indication of where the threads are positioned. And if the skin is too thick, if someone's tissue is very heavy, the threads won't be enough to do the lifting. So assessing someone's skin and tissue is important. Also, if someone's skin is really, really loose and it's come down, if the jowl formation is very heavy, threads are not going to be strong enough to lift those up, so they wouldn't be the right candidates either. So the person who has just the right thickness of skin, just the right amount of sagging or lowering of the tissue, they're good candidates. So really, you got to find the right person. And if someone's not the right person, you need to be comfortable telling them, this is not the right treatment for you. There's some, we have to look at alternatives. So once you found that right person, then they're a great tool. It can be done under a topical local anesthetic in the office. It takes about an hour to do them. And it can, relieve moderate, sagging or loosening of tissue. And it will last for about 1.5 years, maybe up to 2 years. So it's a very effective tool. It's a safe tool, but it really has to be applied properly for the right person.
Yeah, just to give you guys a little bit of a personal experience with it, I have a very thin face, and as I've been getting a little bit older, and I know that I'm still young, so I'm not like delusional. I just want to put that out there because people are like, you're delusional. I know that I'm still young, but one thing that I do have is because my face is thin, and I'm getting older, I get these really deep nasal labial folds, like they're really, really quite deep. So Dr. Goldberg recently just put threads in for me. I wasn't sure if it was going to make a very big difference, and I noticed a huge improvement. It's again natural and soft. It's not like getting a facelift. If you're expecting it's going to be like getting a facelift, you're going to be disappointed. But if you are the right candidate for it, it provides just enough softening that it rejuvenates your skin, with like almost next to no downtime, no drama. I always say no drama, no bullshit. It's in and out. Yeah. And I really liked the results a lot. Like it was definitely worth it for me.
Well, I'm thrilled to hear that, of course, and you're a great candidate because you didn't have that much loosening. Your skin is just the right thickness. So when you came to me and asked me about it, I did that assessment and I felt like you're the right candidate. And I'm glad to hear that it's done well for you and you're pleased. To finish my answer for the question, because the question was about value over time. You get 1.5 years to 2 years out of these threads, and then at that point they dissolve and things come back down. Now you don't lose ground, so it's not going to make things any worse. But at the same time, 1.5 years later, it's going to be time to sort of top up and put some more threads in if you want to maintain the results. If you do that over time, and every 1.5 to 2 years you put in some new threads to kind of maintain things, over time there's of course a cost associated with that. And after about 10 or 15 years, you're getting close to a point where you put in enough money that it's getting close to a surgical intervention. Yeah. So after four to six applications, it's getting close to a cost of surgery. So in answer to the question about what's the value of doing this, really the value is that you're kind of temporizing things. And for someone who's before needing surgery, it's a great solution. But in the long run, what you're going to end up spending after that 5 or 6 applications, which will put you at around 10 years or so, you're getting to a point that you've spent as much as you would have ultimately spent on surgery. So at that point, 10 years or 15 years later, it may be time to consider something like that. But that's not a mathematical equation so much as it's a personal one to say, well, am I okay waiting for 10 years and then doing surgery? Because at the outset of that journey, a lot of people wouldn't be ready for surgery. They wouldn't be the appropriate candidate. So those are kind of the factors in making that decision. So hopefully the viewer got what they need to make that decision.
Do you know what that's called? What you just did there?
What's that?
It's called girl math.
I've heard of girl math before. I'm familiar. I'm trying to learn it. I never took that course, but I'm getting better.
That's how I justify all my expensive purchases. If I wear it this many times, it's only really $20 per wear. Okay, Jennifer sent a super chat. Jennifer, thank you so much for your super chat. Oh my gosh, you are just the best. You're such a wonderful, supportive viewer, and I really do appreciate having you here as a part of our community. So Jennifer said, what do you recommend for hooded eyes? Great question. Big concern. I'm 57 and they are noticeable now. Is surgery the only option?
So great question. When it comes to upper eyelids, there are not a lot of solutions, and surgery really is the mainstay. So hooding up the upper eyelids, there's kind of two parts to it to think about. One is the eyelids, and the other is the brow and the forehead. So, earlier in our conversation, I said that there are parts of the face where things are kind of connected and they're related. We talked about how the chin and the jawline and the neck are kind of a unit. So upper eyelids and the forehead and the brow are kind of one unit. And it's important to think of them that way because hooding of the eyelids is related to descent of the brow as well as excess skin of the upper eyelids. So, the first thing when someone asks me about hooding of their eyelids or anything in the area of their eyes, I take a look at the eyelids and the forehead and kind of see where they're at. Because if the forehead and the brow have come down and they're considerably, causing heaviness onto the eyelids, sometimes that's actually the significant issue. That's the thing that needs to be addressed. And to do that, I do a brow lift procedure. And there are a few different ways of doing brow lifts. But oftentimes that's the best solution. More often than not, eyelids, when someone asks me about their upper eyelids, it's really the upper eyelids that actually are the issue. And it's a loosening of the skin. And it's really about removing that extra skin from the upper eyelid. For some people, that also means a little bit of extra fat. The inner corner of the eye, there's a bit of a fat pocket that can bulge out and cause extra pocket there. So upper eyelid surgery involves removing a strip of skin with a little bit of the muscle underneath and a little bit of that fat from the inner corner. And that's something I'll typically do under a local anesthetic in the office. I mean, it takes an hour to do that. It's a very easy procedure. So it's not a non-invasive and it's not so much of a lunchtime procedure. It's a little bit more than that, but it's not a huge procedure. It's not difficult to recover from. So that's generally the best option. So when someone comes in with hooded eyelids, I'll do my assessment and see how much is forehead, how much is upper eyelid. But oftentimes the best solution for the patient is, upper eyelid surgery. That's called upper blepharoplasty. There are not really non-surgical options for the upper eyelid. So, upper eyelid really is there's kind of that one solution, but it's also a solution that you generally only need to do once in a lifetime.
Okay, so following Jennifer, I had surgery on my eyes. I'm 60. Can this be redone in the future? We got this question often.
That's, and that's a great question and a perfect follow-up because the answer is yes, you can get your upper eyelids done, but I sort of started to allude to at the end of the last answer the idea that you generally wouldn't need to. So for the most part, upper eyelid skin, it loosens through lifetime, and that happens from allergies, sleeplessness. Every time you wake up and your eyelids are a little bit puffy, that kind of stretches the tissue a little bit, and then it comes back down again through the day, and then it stretches a little the next day. Over and over, when that happens, that ultimately results in loose skin. When you remove that with the upper blepharoplasty, that's kind of it. You're done. It's not likely going to occur again. So the answer, can it be redone? Yes. However, more often than not, once you've had your upper eyelids done, if your upper eyelids start to have hooding, if they look heavy again, typically the issue is not the eyelids, it's actually the forehead and the brow. At that point, the brow and the forehead would have come down to a point where they're actually pushing and causing the eyelids to look heavy, and doing a brow lift is the better option because then you're really addressing the issue, and the eyelids look fine. I have had the instance a couple of times in my practice where I've had patients that somebody else operated on and did a series of 2 upper eyelid operations and left them with not enough skin in the upper eyelid, which first, is very disfiguring. And second, can be a functional issue because you lose the ability to close your eyes. It can cause dryness and functional problems. So, and it's a very difficult thing to correct. You end up having to do a skin graft, which I actually did do for those 2 patients. So when I see somebody, I know, to get to that point after a cosmetic procedure, it broke my heart. And again, these were not my patients, but it's one of the reasons when I see someone to talk about their upper eyelids, in my conversation with them, I always raise that. And I say, look, your upper eyelids are the main issue at this point, but your forehead and your brow are part of it. And so when we do your eyelids down the road, however many years from now, if they start to look heavy again, at that point, we're going to want to do your forehead and your brow. And if you've moved and you've gone someplace else, don't go see another surgeon and tell them to do your upper eyelids, because they might. At that point, you really should be looking for a brow lift, because that's the right thing to do for most. So, the answer to this question is, yes, it can be redone. The eyelids, sometimes, if not enough skin is taken the first time, or if it's done early in life and it's been a long time, maybe, but truly, typically, upper eyelid blepharoplasty, it's once and done. And then after that, if they start to look heavy again, then it's time to look at the brow.
Okay. So, wow, that's great. I want to get into Holly's question, but I just have one question to follow up on that question, because this is so interesting to me. I swear I should have been a surgeon. I just love this stuff. I find it fascinating. If you get a forehead and brow lift surgery, and actually, now that you mentioned that, I can very much understand how that all comes together. As a makeup artist, I'm like, wow, that's so true. Because the heaviness is often from the brow, like the forehead falling. Right. And if you lift the forehead, everything will come up with it. So it's not really a removal of the skin issue as much as it is a lifting issue. So if you are to do that, do you get scarring around your hairline? Like, how does that look? What is that like?
So for brow lift, there are 3 different techniques. One involves an incision within the hair across the top. Another involves a series of small incisions in the hair using a little camera called an endoscope. And the third is an incision that does go along the hairline and involves just removal of skin. I do all 3 of those different techniques, and it really depends on the patient. Really, the most important part of surgery, it's not the execution, it's choosing the right procedure for the right patient. If you choose well, the surgery is easy. And so choosing between those 3 different options for different patients is kind of an art form. If someone, for example, has a very heavy brow, and I'm going to be already doing something else like a facelift, then doing the sort of over the top of the head incision makes good sense, and it allows me to lift really heavy tissue and do big movements. But it does change the hairline, so that's a potential issue. For really young patients, I generally favor doing the smaller procedure with the incision on the hairline. And for some people, there's a tall forehead where I can reduce that and actually get a double benefit of bringing the hairline forward as well as bringing the brow up. So there are some nuances to those 3 techniques, and kind of picking and choosing what works for each individual patient.
Wow, that's amazing. That's so interesting. You're literally like plastic surgery is incredible because you're an artist and a surgeon. I find sometimes those are opposing, like oftentimes scientific people are not very artistic, but you have to be both in this situation. Like you really have to be very strong at both. And that's quite a talent. It's incredible.
Yeah, I'm honored. Thank you, and I agree. It was what really drew me to plastic surgery in the first place. Before I got into medical school, I was artistic. I used to paint and draw and sculpt. I did lots of sculpture. I built furniture. So I kind of had that part of me. When I got to med school, I got busy, and I didn't really have the opportunity to continue on with my art. And at some point later, once I was in practice, I was talking to one of my patients, and they asked me this question. They said, Dr. Goldberg, there's a lot of art in plastic surgery. Are you an artist? And I said, well, I used to draw and paint, and I used to do these things, but I didn't have time once I started becoming a physician. And they said, well, what do you mean? You're an artist now. You're an artist of people. And I had never really thought about it, but really it's true. And I really love that part of what I do, because it means I get to use my creative mind, and I get to be both a technician and an artist at the same time, which means that I'm engaged in what I do. There's a certain amount of flow and kind of I really get into my work. Like when I'm in the operating room, it feels like I'm in my studio. I mean, I really feel like I'm working on art. So I love that part of my work for sure.
Yeah, on your little apron, instead of paint splatters, you have blood splatters. It's all I love this for you. Okay, I'm sorry, you guys. I know there's so many questions. I see them coming in, so I'm trying to get to them. Okay, Holly, finally, we'll answer your question. I'm 57. I have sagging and deep nasal labial folds. Oh, I feel you. This is going to be a big problem for me as I get older, I'm sure. Do I need a full facelift? So let's talk about that with nasal labial, like lower face issues.
For sure. So, I would guess the first thing, Holly, is, at 57, you're kind of in that range where a facelift would be reasonable. People often ask me, what's the right age to do a facelift? And honestly, the answer is there is not a right age. I've done facelifts on people in their early 40s, and I've done facelifts on people in their 80s. So the right time is the time that you're ready for it, that you're medically fit for it, and that what you see is appropriate to be addressed by a facelift. It sounds like what you're describing with the nasolabial folds is getting to that point. We've already talked a bit about threads and thread lifting, and that would be an alternative. And the other thing that can be done in the cheek and nasolabial area is filler. So part of the reason that nasolabial folds form is there's a volume loss in the cheeks. And when there's volume loss in the cheeks and the cheeks sort of sag or come down, that fat or fullness lowers, that ends up leaving you with, hollowed cheeks and heavy nasolabial folds. So correcting that can involve adding some volume back in, which is, filler, and using threads, which can pull and bring the skin up a little bit. So from a non-surgical point of view, that would be reasonable. But at the same time, it's a temporary fix. And Holly, the age that you're at, since you're kind of in that range that it would be reasonable to consider a facelift, my inclination, without being able to see in person, would be you're probably at a point that considering a surgical intervention would be the better alternative, because at this age, you're looking at a fair amount of time that this would last you. The people ask me, what age is right for a facelift, and as I said, there's not really one. The other question people often ask me is, how long does a facelift last for? And my answer is, generally speaking, about 15 years. And what that means is it's not like after 15 years that the benefit disappears. But rather, after 15 years, you would have aged, normally to a point that you might consider doing something more to refresh or do another facelift. So, the way I would describe it is, with a facelift and much of the rejuvenation surgery that we do, we turn the clock back, but we don't stop the clock. Right. So, I'll do a facelift for somebody and I'm going to, make them look 10, maybe even 15 years younger. I'm not stopping their aging process. I mean, tissue is still going to lower. There's still going to be fat loss. That's a natural part of life. It's impossible to stop it. So I've turned back the clock, but the clock continues to run. But as I said, there's never a moment in time where the benefit just disappears and it's gone completely. Someone, if, Holly has a facelift at 57, then you're going to have that benefit forever. And even, 20, 30 years from now, you're still going to look younger and more refreshed than you would have if you hadn't had the surgery. So I see your follow-up question, how long will a facelift last? The answer to that, Holly, is it will last forever. I mean, you'll have the benefit from now till the end of time. But obviously, time will continue to pass and you'll continue to age normally. So as I said, typically around 15 years is a time that you might consider doing a follow-up facelift. And facelifts are designed very specifically to be able to repeat them, so that if you have a second and even a third facelift through a lifetime, that's a reasonable thing to do. And if it's staged appropriately and carried out responsibly, that's a very natural, normal look. People often then, think about, when they talk about multiple facelifts, the next thing they ask me about is, what about Joan Rivers? And it's funny, Joan comes up in every conversation I have about facelifts. And some of the viewers may be a little bit young to know Joan Rivers. But, Joan Rivers, for those who aren't familiar, very, very famous actress and personality in Hollywood, but known for the fact that she had multiple facial procedures, cosmetic procedures, to an extent that she looked really overdone, and it was well known, and she was very open about it. But that kind of exaggerated, overdone appearance is not normal. It's not right, and it doesn't need to be that. And she's a person who would have had 20 or more operations, not 2. So that exaggerated look is not normal. And what I'm talking about here, doing a facelift and 15 years later doing the second one, that's not a Joan Rivers. That's a reasonable progression. So Holly, in answer to your question, I suspect that you're in facelift territory. And doing it now in the next few years would make sense. And at some point in your mid 70s, you might think of redoing something like that, or not. I mean, it depends on how you feel at that point in your life.
Holly said, thank you. I definitely am ready for a facelift and I need it. Thank you so much. Holly, are you in Canada? Because if you are in Canada, you should come see Dr. Goldberg, because he really is just incredible. So let us know if you're in Canada. Pop it in the chat and we'll pop it up in a sec. Okay, we have another question for you. Before we get to this question, I kind of have a personal question that I want to ask you. Just That's like a spicy question that I think everyone wants to ask a plastic surgeon and they don't. So 2 questions. One, have you ever had a patient hate their results, like completely freak out afterwards?
So I'm happy to say I have never had a patient completely freak out. I've had occasional patients where our objectives were a little bit mismatched, and I've had to manage that. But I'm happy to report that that's the exception, not the rule. Honestly, the most important thing is as I said, picking the right patient and the right procedure. That equation means the right patient has to have the right expectations, and it has to be something realistic that I can provide. So communication is everything. And if I meet someone who I feel like what they're asking for is unnatural or overdone, or simply not within my skill set, I'm very open about that. If I can't accomplish something that someone wants, I will happily tell them that. And if I think there's someone else who can do it better than me, I will send them on to that person. But the way I avoid those kinds of unexpected, and I can only imagine that will be a very unpleasant circumstance, is finding the right patient and making sure that we're on the same page about what we're trying to accomplish. So happily, I have not faced that outcome.
Yeah, plastic surgery, I feel like afterwards, you kind of go, because I had my nose done, you kind of go through kind of like a wave of emotions where you kind of, when you're healing, you're like, oh God, this was the wrong, like, why did I do this? Is bad. And then you get it off, and then you love it. And then you kind of have this out of body experience where you look at yourself and you don't really recognize who you see, and you have to like relearn your face. So there's a lot of feelings, and being like a licensed hairstylist, when we would do big changes, my clients would go through those feelings, and they would often project those feelings on me, and I had to manage a lot of those feelings. So I can only imagine it being when it's surgical, because hair you can reverse, but surgical you can't. So it really is a tremendous amount of pressure and stress, I imagine.
You're absolutely right. It's it's a lot of pressure, and and it's surgery. So I have to be honest. Like I still feel pressure. I remember the first time I operated on someone, which was as a staff surgeon in 2006. It was it's very anxiety provoking, and still to this day, when I operate on people, there is a sense of pressure. And honestly, I don't think it will ever go away. I don't think it should. What I'm doing to people, there's a lot of responsibility in that, and I take that seriously. But at the same time, I just sort of take that in, and I enjoy my work. And at this point, it's something I've just internalized. And so, going through that journey with people, it's a fascinating one, because as you said, they kind of go through this roller coaster of, there's a bit of buyer's remorse for some time during healing and getting accustomed to those changes. Those changes, very interesting. There is a thing called cortical plasticity, and cortical plasticity, it's kind of what it sounds like. It's the plasticity or changing of your mind, of your cortex, of the way you envision yourself. So your body image is hardwired. It takes about 6 months for that cortical plasticity, for that hardwiring of your body image to get changed. So initially, people, especially facial procedures, they look at themselves in the mirror, they don't recognize themselves, and that can be very upsetting to people. So, initially there's the hand holding and sort of helping people through that process and that change. Once they get past that hump of kind of rewiring and rethinking how they look at themselves, then they're past that, and that's it's great to get people to that point. But as you said, dealing with people as you're bringing them through those significant changes, they will sometimes bring that, project that on you, and there can be there's a lot of stress that comes from that. But that's where good communication and good patient relations come from. One of the things that I really believe, when I meet somebody in my consultation with them, if I can't make them laugh, I won't operate on them. And the reason for that is, if I can't get someone to laugh or be lighthearted before I've even done surgery, while they're healing and they're going through discomfort or swelling or some, asymmetry from the healing process, if I can't have a comfortable open dialogue with them before, afterwards, I'm certainly not going to be able to. So that's why it's really important to me to establish a comfortable rapport with my patients and feel comfortable with them. And if I can't make them laugh, I think I'm a really funny guy. So if they don't laugh at me, there's something wrong.
Yeah, that's a good one. You got to put that like in your checklist. Like, do you have the money? Check. Will you laugh at my jokes? No, you're not the right one. Okay, finally, Christine, can you speak about lower blepharoplasty? So many questions about this. Under eye bags, I get asked this constantly on the channel. There really is no way to hide them with makeup. You cannot hide texture. You can only hide color, right? So what is a surgical option for this?
So it's a great question, and the lower eyelids, there are a few different options, non-surgical and surgical. So let me talk a little bit about the non-surgical and lead to the surgical. So let's talk about the anatomy first. So the anatomy of the lower eyelid and what you're seeing there. There's fat, there's muscle, and there's skin. So the fat internally, there are 3 pockets of fat: by the inner corner of the eye, by the middle of the eye, and by the outer corner. So these 3 pockets, they're behind and underneath the eye, and they're like padding. They're the surface that the eye actually sits on. Those fat pockets are held back. There's a layer of muscle and fiber tissue, and it's like a retaining wall. So for those who are engineers or know about retaining walls, these are things that hold structures in place. And so that fibrous tissue, that muscle, helps hold the fat pockets from bulging forward. And then on the outer surface, of course, you have your skin. So what happens to us over time is that this retaining wall, this fibrous muscle layer, loosens and stretches. So again, with the upper eyelids, I mentioned sort of that repeated episodes of every day, a little bit of swelling, a little bit of puffiness. The lower eyelids are subject to the exact same thing. A little bit of swelling, a little bit of puffiness. People who have seasonal allergies or allergies to dander and whatever at home, those kinds of things, they exaggerate that. They make it worse because you have a little bit more swelling. Every day when you have some swelling, it stretches out that fiber tissue, that retaining wall. And so the fat is loosened a little bit more and a little bit more. And, over 20, 30, 40, 50 years, suddenly that's accumulated. The fat pockets are now bulging forward. You see, these bulging pockets under your eyes, and the skin loosens and stretches over top of that. Along with that, there can be deposits of some blood. So little bits of blood kind of get out around there like a black eye, and it leaves a little bit of a staining in the skin. That's just from the breakdown products of the blood. So there ends up being kind of a collection. The lower eyelid is a very complex area, and there's a lot of parts to what you see there. The extra fat that's bulging forward, the extra skin, a little bit of darkness from the blood deposits in the area. So all those things together, that's what you see for the lower eyelid. So what can we do about that? So on the non-surgical front, we can do things like injections with PRP, platelet-rich plasma. We can do microneedling, and we can do chemical peels, which, the thing that I do, it's called a phenol peel. I think we'll talk about that in a little bit. So the idea of injecting PRP or doing microneedling, they're sort of low-level, very easy, low-risk things that can help tighten up the skin. So they're not really treating the fat on the inside. They're not treating the structure. But just by tightening the skin up a little bit, you can get a reduction of the fat pocket, a little bit of a reduction of the skin. So for sort of more minor things, something like that non-surgical would be a great option. The next step up from that, from a non-surgical point of view, would be a chemical peel. And as I said, the thing I do, it's called a phenol croton oil peel. It's a pretty aggressive kind of peel. It tightens the skin. Again, this is a skin treatment. It's not going to get at the fat pockets or that retaining wall on the inside, but it does tighten the skin quite a lot, and it would be a good option for someone who has a minor to moderate amount of extra skin in the area. The other thing that the peel does is it does thicken up the skin. So it can, for people who have a little bit of thinning skin or crepey skin, it can actually improve that also. So peel of the lower eyelid is a great technique when done on the right person. Past that, once you get past the PRP and the microneedling and the chemical peel, the next step up is surgical. And many people, surgery is the right answer for their lower eyelids. There are a couple of different ways of doing the surgery. So one of the things in the surgery is to remove the extra fat. So those 3 fat pockets that I've mentioned, you need to remove a little bit of that fat and reduce that kind of bulgy part. So one way to do that actually is from the inside of the eyelid. This is called a transconjunctival blepharoplasty. So going from the inside of the eyelid, for some people, if fat is their main issue, then I'll go from the inside. There's no scar on the outside by doing that. You've kind of done scarless surgery. Go in, take a bit of that fat out, get rid of the bulging, And then on the surface, if there's no extra skin, great. If there's a little bit of extra skin, then you can do that peel, that chemical peel. So a really nice combination for lower eyelid is doing that transconjunctival kind of internal fat removal and tighten up the skin with a peel. So that's a very elegant way. And again, that's a scarless operation. So that's a really nice procedure. If somebody gets to a point where their fat pockets are really bulging forward and there's a lot of extra skin on the outside that you can't get rid of with just a peel, then for those patients, then I talk about lower eyelid surgery or lower eyelid blepharoplasty. And for those people, then, full surgical procedure, which involves an incision just below the eyelashes and out with an extension into the crow's feet. And that incision along the eyelashes into the crow's feet allows me to go in and actually take out some of that extra fat from those 3 pockets. The retaining wall, I mentioned, that sort of fiber muscle layer, I actually tighten that up to hold the fat back. So we've actually removed some fat, tightened up the retaining wall, and then on the surface, the extra skin, we remove it. And we remove it by tightening and pulling it out to the side, not up and down. If you pull up and down, one of the risks of the lower eyelid surgery is too much tightening and actually pulling the lower eyelid downwards and causing dryness. So designing operation for lower eyelid is really important, and we want to tension and pull skin to the side, not up and down. So that's a lower eyelid blepharoplasty. Takes about an hour and a half in an operating room. That's done under a general anesthetic. So that requires someone going to sleep or at least being sedated to do that. But it's a relatively short recovery period. So that's a lower eyelid blepharoplasty. But there are some non-surgical options if you're not quite at that point yet.
Wow, that one sounds like a little bit tricky.
You know what? You're absolutely right. It's a tricky part of the anatomy because there's a lot of different parts to it, and you need to address the right things. Also, because it's a lower eyelid, it's a functional place, and so design and implementation, how you fix that is really important, because if you overdo it or you don't design it well, you can cause dryness and functional problems, which is unacceptable from a cosmetic procedure. So complex area with a lot of different contributing factors, functional area, and so deciding what to do for the lower eyelid and picking the right procedure for a patient and designing it well, that's everything. That's super important.
Definitely. Yeah, Holly's saying here, Holly is who we answered the question about the facelift. Holly says, I wish I lived in Canada. She wrote earlier that she lives in the USA. She'd definitely have him do, she would love you to do her facelift. We're getting so many comments about people just loving you. Look, such a fun doctor. And then
you're so sweet. I've maintained my my license in California from when I did my fellowship there. So you never know. One day I may find my way back down to the States.
You better not leave us. We need good Canadian doctors. I swear to God. And then we're having lots of fun with people talking about your accent. And a Canadian accent, eh? And then he doesn't know any very much. You guys, I get made fun of about this every day on the channel. Do you say A when you talk to your wife? And I say A all the time, but I try not to say it on the channel.
I don't. Somehow it never became part of my day-to-day speech. I feel like maybe I need to add it in so I sound more Canadian, eh?
I know, eh? You got to get working on it, eh? Okay, we got to talk about these phenol peels because, okay, first of all, you guys, Dr. Goldberg has a great Instagram. I really recommend you go and you follow him. He does lots of talks on there and reels. It's really engaging. He has some great pictures on there. So we're going to leave his Instagram in the pinned comment as soon as this is over. Okay, so definitely go check him out. But he had this really cool series that he did on phenol. Is it called phenol peels?
Yep, you got it.
Yeah. And so there was this woman who got it done and she was vlogging her experience. So every day I would go check on her. I'm like, how's she doing today? And she'd just be like, hey guys, this is day 5. And it was like her recovery, which was so cool. So it was quite intense. So tell us about that, because I had never heard about it until I started watching your Instagram stories about it. So can you go into more depth about it and what it does and who benefits from it?
For sure. Well, first off, I love doing it. The phenol peel is one of my favorites. And part of the reason that's one of my favorites is because it's super powerful and it's an amazing tool. And the other part is that there's not a lot of people doing it. It's a little bit of an art form. It's I won't say it's a lost art, but it's definitely a not very well known art. So the history of the phenol peel is an interesting one. So call it 50, 60 years ago, there was a plastic surgeon in the United States in Florida, a very, very famous plastic surgeon who was well known for his facelifts, and he did facelifts on patients. And at some point in his career, he recognized that his patients were coming back and they had this amazing skin. And so he asked, what have you done for your skin? Because your facelift looks good, but what happened to the skin? And he found out that there was actually a person who was an esthetician, and in her garage was doing this chemical treatment. And person was from overseas, from Europe, and had this chemical mixture that was able to do this amazing thing for people. So the story goes that he asked for the recipe and she refused, and he later apparently went back and broke into her garage and stole the recipe. I don't know if that's true. I've never had that confirmed, but that's the story. That physician, he passed that on to another plastic surgeon who kind of made it a bit more scientific. The chemicals were all identified and can be ordered, and then that second surgeon went through actually getting concentrations more rigorous and making it more applicable, and that's what the phenol croton oil peel came from. That second generation surgeon taught it to a third generation, and I learned from that third generation surgeon how to do this. So I learned it was around 2009. It was a couple years after I went into practice. And it was a course that I took at one of the American meetings, and I wanted to bring this into my practice, and I didn't realize it was actually the last year the course ran. There wasn't enough interest, and so I was one of the last people that actually got to learn this. There are only a handful of people I know of who do this. So let's get on to the answer to the question and past the history. So this phenol croton oil peel, it's a chemical peel, but people have become accustomed to chemical peels as being something you do at lunch or at a spa. This is not that. This is a much more aggressive thing. This is something that only physicians will do, mostly plastic surgeons, some dermatologists. It involves putting people to sleep. You need a general anesthetic for this if you're going to be doing an entire face. And there's a few reasons for that. Part of it is because of discomfort and the fact that it requires anesthesia. Part of it is also because when you do this, there's some of this chemical is absorbed into the body. You need to monitor the heart and breathing and such. So it's, from a safety point of view, really important to have patients in a monitored setting. But when you go through this peel, what it does, this mixture of phenol and croton oil, it removes the outer layers of the epidermis and also part of the dermis, which is the second layer down within the skin. It's very aggressive in removing those outer layers. And then after that, it's like a controlled chemical burn that a patient would heal and replace with fresh skin. So this is as close as you can get to having a new set of facial skin. It removes wrinkles, it removes sun damage, and once it's healed, it not only tightens, it smooths, it gets rid of irregular discoloration, it removes a lot of redness, it actually removes sun damage, it reduces the risk of future skin cancers, which is a very unique, to my knowledge, there's no other, skin treatment that I'm aware of that can accomplish that. There's no study that I know of that does that for anything other than this phenol croton oil peel. So, for all of those benefits, which are remarkable, there is a significant input from the patient. And that input is, number one, being prepared to go through something in the operating room and having a peel done in that setting. And two, the recovery process is pretty intense. It's a chemical burn, and it's about a 7 to 10 day healing period, during which time there's, fluid, and you need to apply ointment. And it's basically like treating a burn. At the end of the 7 to 10 days, the skin has healed over, and at that point, you can start covering up with makeup. However, the amount of redness that's there is really significant. It's fire engine red. At this point, the skin is inflamed, it's rehealed, and it reduces over time, but it's a good 2 months or 3 months that it will be red. And you can cover it up, you can put on, foundation and makeup and everything. However, it's still red, and you need to be prepared to put up with that. At the end of the 2 or 3 months, there'll be a little bit of a pink color left, not very visible. By the end of 6 months, it's usually completely resolved. So the healing process is that, you get through anesthesia, you get through a general anesthetic, you go home within a couple of hours after that, usually 7 to 10 days at home, kind of treating the burn and getting over that early part of things with ointment and topicals. After that, there's of course a skincare routine that we need to follow. Sun protection is super important. 2 or 3 months of redness that you need to cover up and get over, and then ultimately 6 months before things have really kind of settled out completely. So that's the healing process. However, what you get from that, I mean, the skin it's like baby skin. It's amazing, and even I'm still amazed at the dramatic outcomes that I get from doing this for patients. And it's oftentimes a much better solution for someone than a facelift. So it happens often enough that I see somebody and they ask me to do a facelift, and I see them and I say, look, your bigger issue is your skin. It's the surface. A facelift is structural. It's internal. It's about lifting up the tissue, the muscle, and removing extra skin. But the surface of the skin isn't changed. So I can do a really nice facelift on somebody, but if their skin is not well managed, they're not going to look that great. So oftentimes, a combination of a facelift and then a peel, or a peel and then a facelift later is great. But sometimes patients come to me and they ask about a facelift, and I say, no, your skin is the bigger issue. We really should be doing a peel. That's the right choice. So, it really, again, comes down to picking the right thing for the patient. But when it comes to faces, you need to think of the skin, you need to think of the structure, and sometimes you need to think of both. But you really need to consider both of those things, because oftentimes there is a combination issue.
Yeah, Cleo is asking, does chemical peel help with face wrinkles? So you did confirm that it does significantly.
Yep, absolutely. It's the ideal treatment for facial wrinkles. It's better for someone a little bit later in life, 40 plus, into the sun damage time, into wrinkles. It's not great for scars, acne, and that kind of thing. Young patients ask about it often, but it really is something that, once someone's had that amount of wrinkle or sun damage, that's the ideal candidate for this kind of a treatment.
Okay, great. You guys, it is 6:55. We have time for one more question. So we will get our girl Lori pulling up one more question. Dr. Goldberg has a meeting at 7. We are getting close. Okay, Dana, I have an asymmetrical jaw. The side that is shorter looks like it has premature jowls due to the extra skin. Would I need a facelift, or would some sort of non-invasive tightening procedure work?
It's a good question, and it's a tough question, because facial asymmetry, I guess the one important thing is you're normal. Everybody's asymmetric. We are all asymmetric. Every person has one side of their face that's bigger than the other, and the larger side, the jaw is lower and the brow is higher. That the larger side, your eye is also a little bit more open. People tend to like their larger side because it looks more youthful with a more open eye. The smaller side, the eye is a little bit more closed, a little tighter, jaw's a little bit higher, so it can result in a little bit more jowl formation. So all of this to say, your asymmetry is normal. Differing ages, different aging on the two sides is normal. The smaller side usually ages more because the brow is lower and the jaw is higher. So what you're describing is very typical. The answer, I guess the first thing to know is you can't correct asymmetry. There's no way. You can address certain parts of it, but ultimately what's different in your face is the overall structure. It's the bone, it's the muscle, it's the soft tissue, it's everything. So you can't go in with an intention of restoring symmetry or creating symmetry. It's not possible. So, establish the idea that you may be able to reduce some of the effects of aging overall, and you may be able to improve some of the symmetry or some of the components of symmetry. Those would be the right goals. So start with that. The next thing would be, is this something surgical or non-surgical? A facelift would definitely be able to take care of jowls and the lower face, but is it really even necessary? Have you gotten to that point? Or would thread lifts be adequate? Because thread lifting can take care of some of that asymmetry along the jawline and tighten up skin more on one side or the other. So, the techniques that we've already talked about, facelift, threading, those are very applicable. It's just a question of tightening a little bit more on one side than the other to try and balance things out. In addition to that, there may be a benefit to doing some filler or something along the jawline to sort of help with that and improve the symmetry. And again, all of that within the context of you can try and improve it and soften the asymmetry, but it'll never go away completely. And it's perfectly normal. You're beautiful the way you are. We're all asymmetric. And if I got in close to the camera, which I won't subject you to, you would see all the asymmetries in my face as well.
Cory, I have one more question. Can I ask you one more really good question?
Please.
Okay.
Yes, please, absolutely.
Maria's asking, and everybody wants to know, do any serums work? Retinol, vitamin C, is it all just a bunch of BS? Does any of that stuff work?
Okay, so vitamin C, no, doesn't work. And the premise is good, but the thing about vitamin C is that it's very unstable. So it is a good antioxidant. We can have a whole conversation about antioxidants, but vitamin C, once it's outside of the bottle or container that it's in, which ideally should be airtight, as soon as it's on your skin, within seconds, it's completely denatured. So vitamin C, basically no benefit. So I wouldn't bother. Retinol, yes, absolutely. Retinol, it increases the turnover of the epidermis and the skin, so it's kind of a stimulant, and that helps. That turnover does help. So retinol is good. I have to say, I think it's a bit overused. People who kind of use it continuously over years, they end up thinning their skin. So I think it's good for intermittent use. It's a useful tool. I wouldn't use it continuously long term. That's overkill. I find that there are some issues that can come from that.
Oh my God, I use tretinoin. I'm like hardcore. I'm like beyond retinol every night. Don't tell me that.
Give your skin a break every once in a while.
No, I'm just kidding. Okay. Oh my gosh, this has been so much fun. Thank you so much for taking the time to talk to everyone and answer all these questions. You guys, we have to harass him on Instagram to come back. Go spam Dr. Goldberg.
Maria, thank you so much, and I've seen a couple of the other comments come up. It's my pleasure, Gabrielle. It's I enjoy speaking with you. I really believe that the vision of beauty has changed, and not in a good way. And I think that people like yourself, and I'm hopefully a part of that, can help people really see true beauty in themselves and a natural way of achieving beauty. All of these things are available, but really helping people be open about this and do things that are responsible. But ultimately, be happy with who you are. You're beautiful, and thank you so much for welcoming me on your show. I'd be thrilled to return. So let me know when our next date is.
You got it. You guys, go follow him. We're going to post everything in the pinned comment, okay? And also, we didn't get to all of his before and afters. He has some really, really impressive before and afters. So we're actually going to post those on my website so that you can see this video again. You can watch the replay. It's going to be chaptered. So if you had a question that you want to rewatch, there's going to be chapters. You can go to the chapter. You can watch it, in those little bits. And then you can also see some really incredible before and afters from him. You can see his website. We can get you linked up with him on Instagram. So he's a really great person to follow, and I think you guys will get so much value from him. So thanks again, Dr. Goldberg.
Thank you so much. I'll look forward to talking to you again soon. Take care. Bye, everybody. All right.